You're watching 12 on Health. I'm Gillian Neff. I don't want to gross you out, but we are going to talk about feet right now. Lots of people have issues with their feet, but some new technology may spell the end of one of their problems. A small laser promises to get rid of a fungus that grows on toenails, even if it's been there for years. Here to tell us about it and show us how it works is Dr. Pedram Hendazada. Dr. Hendazada is a podiatrist who practices at Fairfield-based Associated Podiatrists. Thanks for being here.
Thank you for having me again.
I want to show people what this fungus looks like, or what it does to a toe, so they know what we're dealing with and what the issue is. Here's a look at the before picture. What's happening there?
The nail's getting discolored, thickened, and you can see some yellowing.
And why can't you just get rid of that with soap?
It's resistant to soap.
It is. And does it just keep proliferating?
It can. It can spread to other toes. It can spread to loved ones. It can get down to the root of the nail. So
it can spread to other people?
Absolutely.
I didn't know that. Ooh. Yeah. Okay, so you got this issue. It's mostly cosmetic.
It's mostly cosmetic, but it's a medical problem. A fungus is like a bacterium. It's a fungus that grows on the skin and nails, and it's hard to get rid of.
It is. And is it hard? Does it lead to other health problems?
No, generally it's pretty much on the skin and the nails. If you have some immunocompromised patient, they can get fungal infections in the lungs. Oh,
that could be an issue. We want to show folks how this new laser works and what's going on. Here's a patient getting it done. Describe what we're seeing.
You're seeing a doctor that's performing the laser procedure on a patient. We wear eyewear because it's a YAG laser. The laser takes about 30 to 40 minutes.
That red dot folks are seeing is the actual laser at work.
Correct. The procedure takes about 30 to 40 minutes. It's one treatment. You don't need follow-up treatments, and it's about 88% effective, which is more effective than the oral medications that we've been using for about 10 years.
Does it heat it up?
Some patients get a little bit of a warming sensation, maybe like a little pinprick, but it's generally painless. You don't need any anesthesia. There are absolutely no side effects. YAG lasers have been used many years for hair removal and sunspots.
The one you use is called Pinpointe.
Pinpointe is a company that manufactures this laser. It's FDA cleared. It's been on the market for a little over a year. We've had it for about 4 months. It's really amazing. We've had patients drive down from Vermont. We've had 6 from Massachusetts, a couple from Rhode Island.
And are these people who were on that medication and said, you know what, I don't want to be on the medication anymore?
These are some people that were on the medication and then it came back, or some patients that were too afraid to be on the medication because of the ill side effects.
Now, the medication is called Lamisil, right?
Correct.
And that's a strong medication. I know that you have, when you put a patient on it, you have their vital organs checked.
We check for your liver and your blood to make sure it doesn't elevate your liver function test. And we check usually every 4 weeks or 6 weeks. You're on it for about a total of 3 to 4 months.
So it's a strong medication?
It's a very strong medication. It's generally very safe. We've put many patients on it over the years.
Okay.
But now with the advent of the laser, you don't need to succumb to the risks of the oral medication.
So at this point, you consider the laser the first line of defense?
No, if it's a mild fungus, we can put them on a topical. There's some topicals out there that work very well.
Okay.
If that doesn't work, or it's more moderate or severe, we offer them the oral or the laser. The laser, unfortunately, is not covered by insurance.
Oh, so how much does it cost?
You can pay $1,200 to $1,500 in Manhattan. Here in Connecticut, we charge $795 as an introductory rate.
And that's for one visit?
That's for one treatment. We treat all 10 toenails. Even if you have 1 or 2 toes that are affected, we recommend doing all 10 toenails because of cross-contamination.
$795 will get you treatment of all 10 toenails, and then it's done, or you have to come back?
Usually you just need one treatment. Ooh. If you have very, very severe fungus, you might need a second treatment a year, 12 months, 14 months down the line.
Now we saw some video of how it works, and we saw how the laser is actually beamed right onto the toenail. But show us here how you're working with it, exactly where it's going.
Essentially, we follow a pattern. It's the laser beam is kind of like a pen. We go up and down the nail.
And this is obviously, this pen-like laser is connected to a machine, a powerful machine.
A powerful machine. And we go up and down the nail. Actually, we go through it 3 times. That's why it takes about 35, 40 minutes.
Okay.
It is a time-consuming procedure. But again, it's painless. You might feel a little bit of a warming sensation, a little bit of a pinprick. Some patients ask us to stop, go to the next nail, and come back.
Is anybody not a candidate for this?
Somebody who's pregnant, because there hasn't been any studies.
Okay, so you want to just play it safe.
Want to play it
But
safe.
for the most part, anyone with foot fungus, anyone with toenail fungus, might benefit from a laser like this.
Correct.
That is pretty interesting. And how often can you go over it? If it doesn't work in one shot, is it worth coming back for, or at that point do you want to put them on medication?
Believe it or not, we've had certain patients that have been very interested in getting this fungus. So they come back for the 3-month follow-up, and it's improving, but they say, Doc, I just want another treatment. I just want to
They just want to make sure the fungus doesn't grow again.
But they don't recommend another treatment for about 12 months.
And after treatment, do you put them on a topical?
I usually do.
Just to play
the
it
laser
safe.
manufacturer says you don't need a topical. I like to put you on a topical just to play it safe. You have a synergistic effect between the 88% success rate of the laser and the 30-40% success rate of the topical.
We don't have much time left, but what causes this fungus in the first place?
Fungus is everywhere. It's like a bacterium. It's a microorganism. You can grow it in a medium. You can pick it up in a nail salon.
So it's nothing you did wrong.
No, I mean, you can pick it up in a nail salon.
Just
shower.
because you have toenail fungus doesn't make you a bad person.
No.
I'm just teasing. It's very common, and I'm glad there are solutions. Thank you so much, Doc.
Thank you.
Saying so long to trans fat.
Kind of looks like a solid mass of yellow goo.
Not very appetizing. Ahead on 12 on Health, what we can learn from the trans fat ban in New York City.